Hi guys, it's Carmen James again, and welcome to part 3 of the Follow Your Gut series. Now, we've been talking all about gut health, and I have a interesting fact for you. Did you know that the acid inside your stomach is strong enough to burn through your skin? That's really bizarre if you think about it. So you may be asking, well then how come it doesn't burn right through my stomach? Well, that's because your stomach has a mucus lining on it, and that protects it from the acid that's on top. Sometimes a bit of that acid can leak up into the esophagus or the food pipe, and it can give you that heartburn type of feeling. And the reason for that is because the esophagus doesn't have that thick mucus layer that the stomach does have to protect it. So over the past few days, we've been talking about a few tips and tricks to improve your gut health. Simple stuff that you can do immediately to improve your gut health. And we've been talking about how important our gut is. We first spoke about water and increasing our fluid intake. And yesterday we spoke about stress management, and we discussed the various ways in which stress can affect your gut health. And I went through 2 of my top suggestions to reduce stress in our lives. And so the 2 things that we suggested yesterday to manage your stress were meditation and journaling. Now today we are going to discuss number 3 on the list, which is prebiotics and probiotics. Now you may have heard of probiotics before, but what are prebiotics? Prebiotics are a type of dietary fiber, and they're found normally in plant-based foods. So you can think about prebiotics as the food for your good bugs. And some of the places where you can get prebiotics are in fruits and vegetables, in whole grains, in legumes and pulses, as well as nuts and seeds. The benefits of consuming prebiotics are that they improve your digestion, they reduce inflammation, they actually nourish and feed the good bugs in your gut, they help to support immune function in that way, and they also help to reduce your cholesterol levels. We've spoken a bit about probiotics, and essentially in your gut you have good bacteria or good microbes, good bugs, and then you have some bad stuff that starts to come in. And what we ideally want is way more good bugs than bad bugs. It stands to reason. But perhaps even more important than that is we want a wide variety of bugs. I'd like you to imagine your gut bacteria are an orchestra, and let's say it's an orchestra of musicians that are playing exactly the same instrument at exactly the same time to exactly the same tune. That would be pretty boring to listen to, don't you think? And what about an orchestra where all the musicians' instruments are completely out of key, and they're clanging their cymbals and they're playing their instruments and nothing sounds good, and every now and then you hear a shrieking sound? That would be a nightmare to listen to. But an orchestra where each musician has their own instrument and plays it beautifully according to their own melody, but synchronizing with everybody else in the orchestra, that would make a beautiful piece of art. It's the same in our gut. Probiotics are found in 2 places generally. In supplements, so you can get the probiotic capsules and the probiotic liquids, and in fermented foods. Now, you've probably seen probiotic supplements and liquids in health shops, and maybe you've even been prescribed a probiotic when you were taking an antibiotic. I read once in a book about gut health that taking a probiotic with an antibiotic and hoping to keep your gut bacteria, good gut bacteria, protected is the same as filling a bath with water and then taking the plug out, emptying the bath, putting the plug back in and throwing a cup of water back into the bath. Essentially, what I'm trying to say is that antibiotics, while they are very important to help to treat bacterial infections, and they can be life-saving when they are indicated, antibiotics don't distinguish between good bacteria and bad bacteria. So when you take an antibiotic, they kill the bad bacteria, but they also kill the good bugs with them. And so taking a probiotic simply is not going to be sufficient to replenish all the good bacteria that the antibiotic has knocked out. I'll speak a little bit more about antibiotics a little bit later on. And if you ask me, supplementing with probiotics is not necessarily the best way to get a good variety of probiotics into your diet. So the way I would suggest you do it is by incorporating fermented foods into your diet. And in this image you'll see a bowl of kimchi, and kimchi is a type of fermented cabbage. It's actually really delicious. Some types of fermented foods include kombucha, miso, pickles, sauerkraut, tempeh, and yogurt. Now, the benefits of probiotics are exactly the same as what I've told you for the prebiotics, but also they increase your immunity, because remember, these are good bacteria and good microbes that are crowding out the bad bacteria. They also help to lower your blood sugar levels, and they can enhance a healthy skin. So, back to the issue of antibiotics. Studies have shown that doctors are way more likely to prescribe antibiotics if a patient asks for them. And what I found in private practice especially is that oftentimes patients would come in specifically requesting an antibiotic. Let's say you've been sick for about 3 or 4 days and you really need to get back to work and you're feeling lousy and you're just not getting better. And often you've tried a number of over-the-counter medications and you go to the doctor and you expect them to do something that's going to make you feel better. And often you assume that what you need is an antibiotic. Oftentimes antibiotics are prescribed when they are not indicated. And I'd like to urge you to please consider the fact that antibiotics are really detrimental to your gut health. I'm not saying that antibiotics are never indicated, but I'm definitely saying that we can do better with regards to how frequently we use antibiotics. My advice would be to avoid antibiotics as far as possible unless they are absolutely necessary. And finally, I'd also like to raise the issue of unnecessary cesarean sections. Again, I'm not saying that cesarean sections are never indicated, that they're not necessary, but I do think that we're increasing the frequency with which we are performing cesarean sections. Studies are showing that children that are born via cesarean section don't have the same diversity of microbes in their gut as children who are born via natural delivery. So I'm urging you, if it's absolutely necessary and if it's indicated, of course there are emergency situations where cesarean sections are indicated, but we're seeing an increased frequency of what we call elective or non-emergency cesarean sections. And I'd like for you just to consider that with regards to gut health and with regards to that first dose of bacteria in the gut for the child being delivered, natural delivery is definitely the way to go. And so I hope that you've enjoyed these tips on prebiotics and probiotics. I hope I've shed a little bit of light on some questions that you may have had. And I hope that you join me tomorrow for tip number 4 in our series on gut health. Take care of yourselves and bye-bye.